since hair transplants now have become something that a lot of people out there are just dabbling into rather than having a lot of experience, training, know-how to do, I'm seeing a surge of hairlines that look insane. I'm going to focus on one element of the hairline that makes hairlines not look right. There are so many finesse points that make hairlines look crazy. But I'm going to talk specifically about one of them, which is the shape. And I'm specifically going to talk about hairlines for men. Even though I do so many female hairlines, this is one of those things that I see that just makes me cringe. A colleague of mine actually posted this on his website as a good result, and that really stimulated my thinking, going, oh my God, he obviously doesn't do hair. I had to private message him and say, your hairline is not right. So what is it? So basically, from a side view, the hairline for a man must tilt upwards from the center to the side or be relatively flat, but it should not tilt downwards. So when the hairline tilts downwards, it is a female hairline or a transgender hairline, another transgender like a male to a female. So you don't want to tilt the hairline down because it violates nature. Now, what's interesting is that a lot of people that look at these hairlines that are slightly tilted down may not see that it looks fake, but it is actually a fake hairline. And a colleague of mine out of Brazil did a very interesting experiment. He had men draw their own hairline the way they wanted to have it look, and a good percentage of them actually drew a female hairline. And so what you're seeing now is all these novices out there that are starting to do hair draw these female hairlines, and the problem is the patient doesn't know it's not right. Now, why are these novices drawing female hairlines? Why are men who were given a pen to draw their own hairline drawing female hairlines? The reason is very simple. A lot of times there's this temporal gap. In other words, the frontal temporal area is receded back. The temporal area is receded back. The hairline is receded back. And the simplest way that someone thinks about to close that off is to draw a straight line between the temple, the receded temple, and the frontal hairline, which is now a down curved line. It just makes sense. You just curve that in. What's much more complicated is then to draw a recession going back up for the hairline and then down for the temple. That and then to make those angles right are much harder. So just drawing and connecting a line sweeping downwards like a female hairline is logically seems to make sense to either a neophyte surgeon who doesn't know what he's doing or a patient given a pen to draw his own hairline. In fact, one of my staff members who used to work for another surgeon in town she said that he would give the patient a pen to draw his own hairline. And I've seen some of the work coming through here, and that hairline is a female hairline. Now, fortunately, the results are so bad that none of the grafts even grew, so I can actually pluck out some of those remaining hairs and redraw and redo the hairline. But I will tell you that that's one of the major mistakes. And what's very interesting is my colleague in Brazil who did this study actually looked at prepubescent male hairlines. Now, we're talking about not 18 or 20, we're talking about 10 or 12-year-old men or boys who have not become men and have not had the testosterone levels that are stimulating their hair growth, hair loss. And what's very interesting is in those little boys who are very young, their hairlines actually tilt down like a female. So it's very interesting. I didn't even know this, and I just learned this last year, almost 20 years in practice of hair. I didn't know this. But in prepubescent boys, they actually have female hairlines. Or oftentimes they have a more female-looking hairline until testosterone takes effect, and then you start to have a mature male hairline. So what he surmised is that maybe the reason why men are drawing female hairlines is because they're thinking about how they used to look like when they're 10 years old. I don't think that's the case. I don't think men remember what their hairline looked like at 10 years old. I certainly don't remember what my hairline looked like at 10 years old before testosterone hit. I think it's just connecting the two lines very quickly, and that's it. So that's really the reason I think men and newbie surgeons that don't know what they're doing are drawing female hairlines on men inadvertently.